Now we will see about corneal edema. Corneal edema means water in the cornea. Okay, just a minute. Now water content will be normally 78%. Okay, in the cornea, and if it is getting more means it will be edematous. Okay, if it won't get less, it will become more only. Okay, now we will see etiopathogenesis. What is the etiopathology? There will be generally balance between the water draining into the cornea and water draining out of the cornea. Okay, into the cornea water coming is due to IOP and stromal pressure, and it is going out from the cornea due to endothelial pump mechanism and epithelial barrier. Okay, these two are the main reasons. Okay, see, when this balance is lost between the epithelium and endothelium, means epithelium preventing water entry, endothelium preventing water entry, when this balance is lost, it will become watery cornea. Okay, so balance between the draining water and incoming water is lost. That leads to loss of balance. That leads to increased water content more than 78%. That leads to increase in the corneal thickness. That leads to loss of transparency of the cornea. Okay, as I already told you, the causes. Raised IOP means here the pressure will be raised from this side, so there will be increased water entry. Okay, or there will be epithelial damage leading to water entry like this. Okay, or there will be endothelial damage also, again water entry like this. Okay, this is the major causes. Okay, causes means you need to say this one, glaucoma. Raised IOP means glaucoma. Epithelial damage will occur in trauma, burns, radiation like that. Endothelial damage will occur in injuries and dystrophies like degenerative changes and inflammations. Okay, this you need to say if they ask causes means. Now we will go to clinical features. What will be the clinical features? Generally, if there will be more edematous cornea, means there will be haziness and decreased vision initially. Okay, later permanent edema means severe edema will leads to bullae formation and vesicle formation. Logical, right? Now they will rupture of the bullae and vesicles, and there will be pain, and there will be photophobia, and there will be marked decrease in the vision. These all will be the late symptoms. This is the early symptoms. Now investigations means staining of the eye by fluorescein dye and rose bengal dye. You will find any corneal epithelial abnormalities or any injuries like that, and corneal scrapings for culture sensitivity. Okay, corneal scrapings for culture sensitivity. These two are some basic investigations. Actually there are no specific, like in the book it is not given, I written. You can even write some, like for visualizing the endothelium there will be some methods that you can write. Okay, but okay, let it be now for the timing. Now the treatment include general aspects like dark goggles, hot compresses, and diet and rest. This include general measures. Non-specific measures means ABCD mnemonic. A for vitamin A supplementation, B for vitamin B complex supplementation, C for cycloplegics like atropine to decrease the pain, and D for NSAIDs to decrease the pain again. Okay. Now coming to the specific treatment of the corneal edema. Here you need to treat the cause. That is, what are the causes? Here I told you the causes, right? The IOP, raised IOP, you need to treat it. You need to treat the endothelial damage. You need to treat the epithelial damage. So you need to treat the cause, that is increased IOP or inflammation of the epithelium or endothelium. Okay. And second one is dehydrate the cornea by using hypertonic agents like mannitol, like that, glycerin, like that. And you need to blow the hot air over the cornea so that it will get evaporated like that, you think. And therapeutic keratoplasty for any epithelial injuries of the cornea, you can do keratoplasty. Okay, keratoplasty. If you do keratoplasty means it will get healed and there will be no entry of water. It will act as a barrier. So therapeutic keratoplasty for epithelial injuries, and soft contact lenses for epithelial injuries again. Okay, so this is in a short about corneal edema. I hope you understood. Thank you.